we are moving to our next lecture by Dr. N.K. Singh from Dhanbad on gray zone of exercise, how much is much. He is a diabetologist, physician, director, Heart Research Center, Dhanbad. He is a chairman RSSDI Jharkhand. He is ex-governing body member National API. He is ex-chairman API Jharkhand. He is he has edited Millennium Book of Medicine and he has over 30 publications. He is administrator and founder of CME India.
Hello.
And now we are welcoming Dr. N.K. Singh for his lecture.
Yeah, I can start, chairpersons, with permission.
Yeah.
Yeah, let me first share the screen. I am really thankful to Dr. Raka. I think this is something unique conference I have seen, and Dr. Ashish and your faculties and your team. I think it is always difficult to talk after uni, which I have heard in the ADA meeting being quoted. So great pleasure, Dr. Unni, and also great reformer Dr. Alok Kumar Gupta is being seen here. Okay, so let me share the screen first. Oh, wait. I think my first slide is just disclosure slide. I think there is some problem, but anyway, it was when Dr. Raka told me it is not possible to say no at all. So thank you very much, Raka. So let us start in next 20 minutes. What we have to do, he have given something new topic to me, which could be quite interesting for all of us. So gray zones in exercise. So this is when he told me to talk on this. There are lots of gray zones in exercise, especially in diabetes. And in all gray zones, it is always not easy to know how much is how much. So let us see what is the reality in all these things. Remember, you will never get anywhere by staying in your comfort zone. This is very, very important saying. And why you want to avoid the gray zone and how to do it. No matter, Confucius told that no matter where you go, there you are. So balance is in the gray zone. So I'm happy you gave me this topic. So there I found that there are lots of gray zones. Why people do not do exercise? Why some people do not respond? And many gray zones about aerobics, resistance or heat, what to do. Intensity is better or duration. Morning better or afternoon. After food, why someone walk? In COVID era, should we walk? Pollution, should we walk? I have got osteoarthritis, what to do? So there are lots of things. Let us deal one by one. Remember, this is a very, very important thing. First thing I would like to tell that amazing science of exercise persists. It only exists here. But why do we fail to follow? Everybody is well aware that insulin is not required for glucose to enter into cell when you are exercising. And always I tell that this is CMGU, that is the contraction mediated uptake occurs when you exercise. This is a non-insulin dependent, so essentially muscles contractions allows glucose to enter the cell. And even after finishing your exercise, this CMGU continues for several hours post-exercise. And everybody is aware here again that both whether you do aerobic and resistance, there is reduction in HbA1c. You can see here, but when you combine aerobic and resistance, even this improves the insulin sensitivity around 70% and lower HbA1c in the tune of 0.9%. So this is marvelous again. So my first point is कि if you educate your patient and if you give some molecular mechanisms and that is get imprinted on your patient's psyche, it acts as a motivational force to do regular exercise. So here we are failing at all. I will not go in details ki how it is working at genetic level and what is happening. But remember, that inter-organ cross-talk and subtract flexes during exercise. Lots of things are happening. So just get some time to explain your our next patient what is happening when you are doing exercise. Inactive individuals might not know that movement can help them feel better now. Again, this is a very, very important saying that you don't, we are always saying you do exercise, will be benefited, you will be not benefited after 1 month, 3 months, or 1 year. Tell him that you will feel better now and get permission to move in ways that feel good. And for that, I think we must choose to move. What is move? That is move to optimize your vitality and enjoyment. Exercise gives you your vitality, it is joyful, well-being, better mood immediately. You enjoy the exercise, you have fun with exercise, you become less anxious and clearer mind that enhanced sex drive also occurs. So prescribe a thing which includes all these things in your exercise. Now someone saying that I am not doing regular exercise, what will happen? But remember कि both either you do regular and irregular training groups displayed in one exercise, the significantly improvements in anthropometric characteristics, aerobic capacity and some blood lipids. Thus the current study, this study which I am showing here, that suggests that performing regular training when possible, however irregular training could also offer less benefits and should still be considered if there is time for individuals. So even it is someone is doing regular, don't demotivate them. What to do exercise in this COVID era? Remember, this is a very, very important issue. And how exercise augments host immune defenses is multifaceted. But a key mechanism is the frequent mobilization and redistribution of effector lymphocytes. And literally, when you exercise, billions of lymphocytes are mobilized in response to just a single bout of exercise. Is it not amazing? Particularly if the exercise is dynamic and taxes the cardiorespiratory system, that is running, cycling, or rowing. So, importantly, there is a catecholamine mediated preferential mobilization of those lymphocyte subtypes that are capable of tissue migration, and their phenotypic signatures indicate that they are primed and looking for a fight to recognize and kill the virus, or this all Omicron virus. So this is all I am telling you has got a proper study done and validated. So there is an increasing evidence that the circulation surge in cells of the innate immune system with each exercise bout and the anti-inflammatory and antioxidant effect of exercise training have a summation effect over time in modulating tumorigenesis, atherosclerosis, and other disease processes. What to do with the pollution and exercise? Here is there again in diabetology. Last year, the habitual exercise is associated with a reduced risk of diabetes regardless of air pollution. So again, something very good message is coming. I think again sometimes what happens is not all diabetics respond to metabolic effects of exercise, and this is a fact, and this is really a big gray zone. So this happens, or this brings the era of personalized medicine in exercise too. Around approximately 15 to 20% of patients will fail to improve their glucose homeostasis, insulin sensitivity, and mitochondrial density after proper supervised exercise training. So it is critical to know which one will respond and which one will not. At present, there are no specified ways to segregate responders and non-responders in this gray zone. Responders get reward for doing exercise and non-responders feel disheartened. So the reason is that new research saying that the muscle-specific microRNA plays a role in a skeletal muscle response to exercise. I will not go in detail of all these things, but this is happening. But still I will say if the patient is not responding to bringing down the HbA1c and other things, it will benefit the patient in many other ways. Now, many times people will ask you, okay, sir, what to do with the types of exercise? Should I go for the HIIT exercise? Should I go for aerobics? Or should I go for resistance? Everyone is thinking that aerobics is the only answer, But remember, this is not a well-known gray zone now, as resistance training is critical for all of us. Normal loss of muscle mass with aging occurs. So there is accelerated loss of muscle with physical inactivity, disease including diabetes and rapid weight loss. So carbohydrate storage tank is very critical, both total capacity and depletion. So if you go with this slide, this is a big, I think, busy slide, but anyway, even the aerobic exercise leads to increased capillary density, mitochondrial size and volume, oxidative capacity, and if you do the resistance exercise, increases in lean body mass and a strength and improved glucose utilization. So several studies have now shown that the resistance exercise is more effective in improving this glucose transporter 4 number and function. So it is highly effective in slowing sarcopenia and which has a close association with type 2 diabetes. What about the heat? As everyone is now aware of what is heat, so I'm not going details, but the glycemic effects of different training intensity, you can see here that there is beneficial effects of continuous aerobic exercise, the blue line, and heat confers superior glycemic improvements as compared with the continuous moderate intensity training with a lower time commitment. So this is again great. If you think about any role in type 1, adults with type 1 diabetes can engage in heat and manage blood glucose with appropriate regime changes. So again, so even if you are doing the sprint interval training, that is something form of same thing, almost same thing, but the SIT protocol, if you do 3 minutes of intense intermittent exercise per week within a total time commitment of 30 minutes is as effective as 150 minutes per week of moderate intensity continuous training for increasing insulin sensitivity, cardiorespiratory fitness, and skeletal muscle mitochondrial contact in previously inactive man. So this is a very, very important message in coming. Now, sometimes people think that, oh, which one is important, intensity or duration? Current research clearly demonstrates that intensity is more important than duration. At low intensities for an extended period of time, fat becomes the primary fuel source, and this is far less effective at lowering blood glucose. Intensity ranging from moderate to high utilize more carbohydrates, glycogen for fuel, and therefore are more effective in lowering blood glucose. So this should be clear. What about the seating time? You see the different how representation of the relative energy expenditure when you are doing a standing or walking or bicycling. So now the research is coming and it is clearly showing that in addition to increasing purposeful exercise, decreasing sitting time has the potential to reduce the burden of type 2 diabetes. And even if you do a interrupted sitting, may improve the glycemic control. So again, this is a very, very promising exercise intervention. Say interrupted prolonged period of sitting with 15 minutes of walking after meals and either light walking or simple body weight resistance activities undertaken for 3 minutes after every 30 minutes of inactivity can improve overall blood sugar control. So there is well done research. You can see here, even that all daily movements are very important. If someone is not doing a regular aerobic exercise or resistance exercise, even some daily movements, that has also is not a gray zone now, it is well validated again. And there are many research coming up that walking with the dog improves everything of their physical activity. This is evidence is so far. So numerous studies have confirmed that dog owners are more physically active than those without dogs. But also that not all pet dogs are walked regularly. That is the problem. This is my dog anyway. So here, the next sometimes you will have wonder what is happening with the exercise, and we usually do not talk about it. But what is the science saying? You see here the conclusion of this study is that higher cardiovascular exercise levels in physically active adults are inversely associated with erectile dysfunction by self-report in men and protective against female sexual dysfunction in women. So this is could be sometimes the motivational force. Exercise has positive effects on the sex drives of men, and exercise has positive effects also on the sex drives of women, and ultimately it leads to what? Increasing sex drive can be one goal of an exercise program, but it would be wise to incorporate additional goals like you do, say, for stamina, strength, balance, and stress relief. But definitely, it improves the endothelial dysfunction. This is quite clear. Many debate is going on in, and this is a really gray zone. Ki morning workout is better or evening breakout workout. I think this is an important research coming up again in the, from the diabetologia that afternoon exercise is more efficacious than morning exercise at improving blood glucose levels in individuals with type 2 diabetes, a randomized crossover trial, and this is quite showing. You can see here if your red one is the morning and this blue one is the afternoon, and in the time of day is being shown. So pre-training, post-morning, and post, so you exactly what you're saying that everything is improving. So I think again this timing gray zone should be quite clear. Advice to walk after meals. It is more effective for lowering postprandial glycemia in type 2 diabetes than advice that does not specify timing. So this is again a randomized crossover study, and the benefits are related to physical activity following meals. So again, this is a current guidelines should be amended. I think this has been already amended. So morning versus afternoon resistance exercise in individuals with type 1 diabetes. This is also showing that the compared with afternoon to morning exercise and associated with different, distinctly different blood glucose responses and post-exercise profiles. So exercise after you eat, hitting the postprandial glucose target is very well shown in this graph. So you can see here that lots of studies has appeared. So I think of next two or three more gray zones like exercise is medicine, but does it interfere with the medicine? Well, the transient responses to acute exercise, such as diversion of blood away from the liver, reduced plasma volume, and blunted drug metabolizing enzyme activity, are suspected to quickly and profoundly alter a drug's blood concentration. So, what you do? Uh, Chronic adaptations to exercise include body recomposition, a more resilient gastrointestinal tract, greater bile acid production, and enhanced enzyme activity, which, when taken together, have the potential to elicit significant changes in drugs' pharmacokinetics. So, the dose should be personalized, and that is the answer. So, how much is much? You see that this is what happened in the Greek sent their fastest runner here to carry home news of the victory, and he sprinted 26 miles from the battle site. You can see here. He arrived and said, "Rejoice, we conquer," and died from exhaustion. So marathon race is named after this event. This is considered. So I think the ADA has given clear-cut guidelines now. What should be the intensity, what should be duration, how frequent, and what type of exercise. I'm not going to read out in detail, but this must be very clear. And what could be the maximum age? I think this is a very very famous पोइट्री बाई अटल बिहारी वाजपेयी जी कि चाहे जिधर से गुजरिए मीठी सी हलचल मचा दीजिए, उम्र का हर देख दौर मज़ेदार है, अपनी उम्र का मजा लीजिए, उम्र की ऐसी की तैसी इसका शीर्षक है. सो गाइडलाइंस रिकमेंड इंड्योरेंस ट्रेनिंग, रेसिस्टेंस एक्सरसाइज, flexibility and balance exercise. There is no consensus in literature for the age range which defines the older adult or elderly. In general, guidelines suggest that those 65 years or older can be considered older adults, but exactly there is no clear-cut guideline to tell you that a 90-year, there are in all types of examples are when this happens that when the runners, marathon runners are also 90 or 98 years are running. So I think this is again a very gray zone, but it depends on how you have trained your body. So this is very very important. And from the Journal of American College of Sports Medicine, if you are suffering from arthritis, cancer, and many other diseases, there has a clear-cut guideline ki what you should advise for your patient. You can look for that. So lastly, remember always that some activity is better than none and more is better than less. So do not sit if you can stand. Do not stand if you can walk. And do not walk if you can run. I think this is a great saying. And yoga must be included in the lifestyle modifications, as the yogic practices are also likely to play a role in the prevention of type 2 diabetes. Thank you very much For patience hearing, thank you very much.